Now I request Dr. Mathew Johnson to talk on making IOL implantation easier and perfect. Mathew Johnson is a phacosurgeon at Mother Care Hospital, Mannarkad, and he's been doing topical phacos for quite some time now.
See, once one of my first year PGs came and he was in seeing cases. He came at the end and asked me, sir, 2 cases. You put intracameral lignocaine and waited for 1 minute. Other cases you did not do. Why, sir? So I appreciated her for seeing that. But then it was in high myope patients. So in high myope patients, I always inject a little more of intracameral xylocaine so that it anesthetizes the ciliary body area better. Because even if you lower your bottle height, there is going to be reverse pupillary block and the chamber will deepen more and they'll have some kind of discomfort. So to avoid that, this helps.
That is a wonderful tip by an experienced surgeon. Yeah, so in high myopes, it may be a better idea to wait for a little longer. Thank you.
Good afternoon, everybody. My topic is making IOL implantation easier and perfect in topical phaco. So what is in a surgeon's mind while implanting an IOL? There should not be any damage to PC and both haptics should be in the back. We should clear all the viscoelastic from AC, back and behind the IOL. There should not be any CBDS, that is capsular back distension syndrome post-operatively, and after all we should finish the case as fast as possible. So to avoid damage to PC, it can be achieved by visco-assisted IOL implantation or by hydro implantation. But the problem is that once I had faced a case where overinflation of bag with visco it can cause a rupture, PC rupture while tucking in the haptic, especially if it is a plate haptic. This occurs when visco gets trapped between the optic and PC while IOL is forcefully tucked into the bag. The solution is that we should inflate just enough visco so that the eyeball isn't soft. Remember that we have visco inside the cartridge also. But the best solution which I found is that we can do hydro implantation. We have no worry about visco trap or PC damage. And both haptics should be in the back. It can be achieved either by visco implantation of IOL or by hydro implantation. Clear the viscoelastic from AC bag behind IOL. It is a time consuming to aspirate visco from AC bag and behind IOL, but it is the most important for best early post-operative outcome. So is there any way we can skip this step of visco aspiration yet clear out all the visco inside the eye? Yes, by hydro implantation. And prevent capsular back distension syndrome post-operatively. It is due to the visco trapped between the IOL and the bag, which cause a myopic shift in the IOL, which can cause an early post CBDS, which is a myopic shift, and in late post-operative period, early incidence of PCO can also occur. Solution is NDR capsulotomy. Prevention is by thorough visco wash from behind the IOL, but the best method of prevention is by hydro implantation of IOL. And finish the case fast by learning the art of hydro implantation. So the steps of hydro implantation I have written. I'll just go through it and show the videos. IOL implantation without using viscoelastic. Keep the irrigation in on position and inject the IOL through main port with the dominant hand. Irrigation in the non-dominant hand. The visco inside the cartridge gets washed off through the opposite side port. While injecting direct the IOL into the bag, keep the irrigation probe over the inserting IOL as a guide to prevent the IOL from being opened up in the AC. That is an important point. Leading haptic opens into the bag and lagging haptic opens in the AC, and then we can use the aspiration probe in off position to tuck in or dial in safely the IOL into the bag. I'll just show the videos. Hold presentation. That is all presentation. So you can see the irrigation is in on position. To the other side port, you can see the water is escaping. So you can see the visco which is escaping through the opposite side port, and I am using the irrigation probe as a guide to direct the IOL behind the irrigation probe into the bag. And using the aspiration probe in off position, I'll just tuck in the lagging haptic. Okay, I'll show a few more videos of the same. I'm using the irrigation probe to guide the IOL behind the irrigation probe into the bag, into the opposite pole of the bag, and the lagging haptic is being tucked in. So after this, there is no need of visco wash. Just take out, seal the wound. So in this case, actually, this is basically the cartridge is in the AC. And I am just, it is very easy if the cartridge is in the AC. If it is wound assisted IOL implantation, we have to have the irrigation probe to guide it. But if the cartridge is in the AC, it is very easy. It will directly go into the bag. There is no need of guiding with the irrigation probe. Another video when the cartridge is being in the AC. You can see the cartridge here. So this is about the hydroimplantation technique. So what happens if I don't use the irrigation probe as a guide? I'll show in the next video. The IOL, since there is no visco, IOL can dance in the AC in the BSS. There won't be, we can't just control where the IOL is going. So we have to actively use both the, sorry, it's not that one, just, so, see, so the IOL just opens up. So we have to use both irrigation and aspiration cannula to correctly position the IOL and dial it into the AC. One more video of the same. So for the beginners, there is another technique where we can use the visco as well as hydroimplantation. But I found this as the most useful technique, just guiding with the irrigation probe. Thank you.
Thank you, Mathew, for that illustration of hydroimplantation. Yeah, once you're confident, you should be confident about doing it under visco initially. Then, when you convert, you should be quite confident about doing it. You shouldn't be doing it first thing on a clear corneal tunnel. The initial cases probably you can do visco assisted,
yes,
so that you're more confident, and then you can go.
Yes.
Second thing is when you inject, if you bend the injector a little bit when the trailing haptic is going in, most of the time it will slip into the into the bag, and you don't need to worry about it.
Sir.
But definitely saving time in a topical phaco is very important, because we have to finish the procedure fast.
Yes, sir.
So it will go a